So I'm going to just put this up against your nostril.
Now we hear it. And now that's checking with sound waves the structure of
the airway, nasal airway.
Okay, and then this is the...
This is a pharyngometer.
All right. Everything seems to be hooked up to computers. Do they all take... I mean, is that an important part of what you're doing?
It's an important part in my practice.
By that, do you mean there are people that, quote unquote, eyeball it?
I'm sure there are, but the computer doesn't lie. It gives me objective data.
How important is diagnosis, do you think, in your practice?
Oh, it's vitally important. There's many other things that can cause, airway issues, sleeping issues, TMJ issues. We want to make sure that it's something that's within the scope of my practice to treat.
And you don't normally, it's my understanding, you don't normally prescribe medicines for any of this. You pretty much treat them using...
I use appliances. We attack the structural problem, whatever's at the root cause.
And by doing that, you can fix it so that they can get off the medicines?
Most of the time, yes. And one more test here, David. Okay, just pinch your nose with your left hand again, and breathe in and out for me. Okay, hold your breath right there. Beautiful. Super.
And that's it?
That's it.
That's the whole test?
That's the whole test.
And so basically what you do is you practice the science of sleeping and feeling better.
Right.
Everything seems to be run by computer programs. You don't seem to guess too much.
No, I don't like to guess.
You've made mention, I've talked to a few people, that a lot of people who have TMJ also have sleep issues. Don't sleep well at night, maybe don't breathe. You also treat sleep apnea or sleeping problems here because it's all part of the same joint, right? The same function. Correct. My understanding is if I go to a medical doctor and I am diagnosed with any type of sleep disorder at all, I snore, whatever, they're going to give me this.
That's correct.
Of one version or another. This is called a CPAP, and this constantly blows pressure all night long. I have friends that have these. They don't wear them.
Right.
Because obviously, this is very romantic if you roll over in the middle of the night. Plus, it makes a noise all night. It makes all night.
Right.
You told me, or made representation, that you're able to treat 85 to 90% of people with sleep problems. Obviously, the severes, they need the CPAP. This is still the gold standard.
Right. But
with an oral appliance.
Correct.
Explain that to me. Why would anybody get this instead of one of these?
Well, that's been the gold standard. You just mentioned it. That's what's been out there. It works quite well when it's warm.
Right.
Especially for severe cases.
I don't know anybody
I think
that
the statistics are less than 20% after a year.
So for 80%, they don't work at all?
They're not, yeah, because they're in the closet. They're not working.
And why? Is it because it's so cumbersome? My buddies that travel, they can't take them through the airport. They can't.
Yeah, it's cumbersome. A lot of times patients that are snoring, one of the chief complaints that gets them in here is that they're sleeping in separate bedrooms. It's disturbing their spouse because they're snoring. Well, then they find out they have sleep apnea and they put this nice mask on that's making the nice whirring sound all night long. They're still not sleeping in the same room because of the noise. Okay,
so tell me about what, and again, I told you when we talked on the phone, I would never have thought to go to a dentist because I snore. Although the mouth is your specialty, tell me what you're doing and how it works, because this looks far simpler. This is really what people wear.
Right.
Show me how this works.
Basically, this is a two-piece appliance. You take somebody whose lower jaw is back, like this.
Right.
I mean, typical overbite patient.
Okay.
You use an appliance. It's kind of like a retainer. This particular design is two pieces.
So I could still eat and open my mouth and drink water, and I'm not locked in.
Right. Brings the lower jaw forward.
And success rate?
Probably 80–90%.
I was at my personal doctor's, and she said, "How are you sleeping?" And I said, "I wake up every 2 hours." And she said, "I'm going to give you a prescription or a recommendation or a referral to go to a sleep clinic, get a test done." I said, "Okay." I went in and stayed all night, and I'm sitting up there, and the guy comes in, and he puts this mask on my face, and I'm thinking, what is this? I didn't lay down the whole night. I slept setting up. And he said, "Yeah, this can help you." So I went home, and they gave me one like $4,000 or $5,000, and it's sitting on a shelf at home now because I hated it. I wore it at home. I finally moved out of the bedroom. My wife couldn't go to sleep. She's a light sleeper, so I'm sleeping in the other bedroom, and I'm thinking, okay, I'm sleeping well, but my wife's in the other room, and I hate this. And I called Dr. Dawn, got an appointment, went through her program, and I'm back in the bedroom. I'm sleeping quietly. I'm dreaming.
We took him through all of our testing, found out that we could open his airway just by putting a mouthpiece in, and within just a couple weeks we had a mouthpiece in his mouth, and he's been much better ever since.
I asked Dr. Dawn, I said, why wasn't I given this option at the sleep clinic? Why wasn't this presented to me? And my thoughts are they don't want somebody cutting in on the business, cutting in on their business. Whether that's correct or incorrect, that's how I first thought of it. It's like, what's going to help this person or what's going to make us money? It does work, and it's so much simpler than a CPAP machine. Anybody want to buy a CPAP machine? I've got one for sale.
Dr. Slick, thanks, first of all, for spending the day with me and letting me interview your patients and talk to them. But it still concerns me that everybody tells the same story. I mean, everybody tells the same story. They've been to multiple doctors. They've done this, they've done that. They finally came to you, they got help. They all seem to have gotten help. If this is so great and it works so well, why isn't everybody doing it? Why aren't doctors sending all their patients to have it done?
Well, I think that we're taught very little in all of our professional schools about TMJ, including in dental school. Physicians are taught very little, chiropractors are taught very little, and unfortunately dentists as well. So they don't know about it. It's not their fault.
I'm not to cut you off, but you, I believe, teach, do you not? Do you not teach others about TMJ?
I do. I do.
So you probably have a little bit better understanding than most?
I would think so. I probably have studied it more. In order to teach something, you kind of have to really know
So should people ask their doctor if you have headaches? I mean, the list, headaches, fibromyalgia, vertigo, vomiting, back pain, neck pain, you don't sleep, you snore. Should they ask their doctor, can a dentist help me? I mean, how would they go about finding a dentist that's qualified to help
Well,
them?
I think first of all they need to ask their doctor, could this be TMJ? If they're starting to think that they have a TMJ problem, could I have a TMJ problem? And depending on what the doctor says, then go forward to find somebody. There's lots of resources on the internet as far as finding people who treat this. There are several organizations that I belong to that are a group of doctors who have treated much like, or trained much like I have to treat this.
Now, those doctors, obviously sleep apnea, you said 70 or 80% of the people with TMJ normally have a sleeping issue?
Right.
And about the same number of people with sleep issues normally have a TMJ issue.
Right. They go hand in hand. It's the same problem. The jaw's in a faulty position.
So you could snore and think, well, I just don't feel good because I didn't sleep well last night or what, and it could all be in your joint.
Right.
And it's not that big a deal to fix if they find the right person.
Exactly.
So what would you tell people if just to go get checked? I mean, what should they do?
Well, I always encourage patients to seek help from their own family doctor, their own family dentist with whom they already have a relationship. But I see plenty of patients come into my office who don't come on referral. They just find me in the yellow pages, find me on the internet, think they have a TMJ problem, they call me, and we're more than happy to see them. What's the worst they have to lose? 30 minutes out of the day that might change their life.
Well, I want to thank you again for taking the time to visit with me, to explain this to me, and to share your knowledge.
Thank you so much.
You've been watching Medical News Network. I'm Mike Wiggenstein. For further information on this subject or any other, please visit our website at medicalnewsnetwork.info. Until next time, I wish you good health. Thank you, Doctor. You're great at this.